Welcome to the Learning Pines YouTube. We hope this video helps.
You begin by collecting only the essentials you will actually use. Focus on quality over quantity. Place bandages, sterile gauze, antiseptic wipes, and gloves in one compartment so you can access them quickly. Add a small pair of scissors, tweezers, and a compact flashlight for visibility and minor procedures. Include an emergency blanket and clearly labeled medications with dosages. Once done, arrange items by frequency of use. This reduces delay in an emergency and makes restocking straightforward. Now you organize and customize. Separate items into pouches by function so you can grab exactly what you need. You should tailor the kit to allergies, ages, and the activities you do most often, and include any specialized items for local risks. Write a clear medication list, dosage instructions, and emergency contact info on a waterproof card. Once this is done, perform a quick walkthrough in your head of how you would use the kit. This mental rehearsal exposes missing items and speeds real responses. Finish by sealing your kit in a durable, water-resistant case and attach a checklist with restock dates. You must inspect contents every 6 months to replace expired medications, replenish used supplies, and check that packaging hasn't degraded. Store the kit in a consistent, known location and tell household members where it is. If you discover a missing or unsuitable item in an emergency, improvise using a clean cloth or plastic wrap, mark the deficiency, and restock immediately so the kit is ready for the next use.
Thanks for watching. Consider subscribing if we helped you.